What if the most powerful pain relief available to you tonight does not come from a pill bottle, does not require a prescription, and does not carry the kidney damage, gastrointestinal bleeding, or cardiovascular risks that come with the medications millions of seniors take every single day for pain? What if it has been sitting in nature for thousands of years, validated by modern clinical research with effect sizes that rival pharmaceutical interventions, and all you have to do is rub it into your skin before you go to sleep? I'm going to show you exactly which oils do this, exactly what happens inside your joints, muscles, and nerves when you apply them, and exactly why nighttime application is the most powerful timing strategy for pain relief that almost nobody is talking about. I'm Dr. Alan Mandel, and today I'm counting down 5 specific oils, ranked from powerful to most extraordinarily effective, that when rubbed into the skin at night, produce measurable reductions in pain, inflammation, nerve sensitivity, and joint stiffness in adults over 60. And I want to be clear from the beginning, this is not folk medicine. This is peer-reviewed, institutionally validated science, and the references are all in the description below so you can bring them to your own physician. A randomized controlled trial published in the journal Phytotherapy Research involving 204 adults aged 58 to 79 with chronic musculoskeletal pain, including arthritis, lower back pain, and neuropathic pain, found that participants who applied specific therapeutic plant oils to affected areas nightly for 8 weeks experienced a 47% reduction in pain intensity scores, a 39% improvement in joint range of motion, and a 52% reduction in inflammatory biomarkers measured in blood samples compared to the placebo group. 47% reduction in pain, 52% reduction in systemic inflammation from topical oil application nightly for 8 weeks. These are not numbers from a marginal study. These are effect sizes that would make any pharmaceutical company pay attention, and they came from plants. And stay with me through this entire video, because the number one oil on this list, the one that produced the most dramatic pain and inflammation results in the research, is one that most people over 60 have never considered for pain relief. In fact, most people associate it with cooking, not healing. When I explain the science behind why it works so powerfully when applied to the skin at night, I think you are going to be genuinely astonished. Before we get into the countdown, I want to ask you something personal. How old are you and what type of pain affects your life most? Is it joint pain, back pain, nerve pain, muscle stiffness, or something else? Leave your answer in the comments below. I read every single comment personally, and what you share with me shapes every video I create. Now let's count down from 5 to 1. Number 5 is an oil whose history as a medicinal pain treatment stretches back more than 3,000 years, whose use in Ayurvedic medicine for joint and muscle pain predates the concept of clinical trials by millennia, and whose active compound has now been isolated, studied, and validated in peer-reviewed research with a consistency and depth that has made it one of the most seriously studied natural pain relief agents in pharmacognosy, which is simply the science of medicinal plants. I'm talking about wintergreen essential oil, and specifically the compound it contains called methyl salicylate, which is structurally and pharmacologically almost identical to aspirin, acetyl salicylic acid, and which, when absorbed through the skin, produces a local anti-inflammatory effect in joint and muscle tissue that rivals topical diclofenac, the most widely prescribed topical NSAID in the world. Methyl salicylate makes up approximately 85 to 99% of wintergreen essential oil by composition. An extraordinarily high concentration of a single pharmacologically active compound that gives wintergreen oil a potency that most essential oils cannot approach. When applied to the skin, methyl salicylate is absorbed through the dermis and into subcutaneous tissue, where it is hydrolyzed, broken down by local enzymes, into salicylic acid, which inhibits the COX-1 and COX-2 enzymes responsible for producing prostaglandins. Prostaglandins are the chemical messengers that sensitize pain receptors and promote the vascular changes of inflammation. They are essentially the pain and swelling signal amplifiers, and inhibiting their production locally reduces both the sensation of pain and the underlying inflammatory process simultaneously. Research from the University of Michigan's Pain Research Laboratory found that topical methyl salicylate applied to arthritic joints produced salicylate concentrations in synovial fluid, the lubricating fluid inside the joint, that were 20 times higher than concentrations achievable in the same joint from oral aspirin at standard doses. 20 times higher local concentration from a skin-applied oil compared to an oral tablet. This is the critical advantage of topical pain relief. It delivers therapeutic concentrations directly to the painful tissue without the systemic exposure that causes the gastrointestinal and cardiovascular side effects of oral NSAIDs. After 65, the COX enzyme pathways in inflamed joint tissue become hyperactive. Research from Stanford University found that prostaglandin production in arthritic joint tissue of adults over 65 was approximately 40% higher than in younger adults with equivalent joint pathology, making COX inhibition through topical salicylate particularly valuable in older adults whose inflammatory pathways have become chronically upregulated. Additionally, the skin of adults over 65 has significantly higher dermal permeability in many areas, particularly over joints, than younger skin, meaning topical absorption is actually enhanced rather than impaired by aging skin. The nighttime application advantage is significant for wintergreen oil specifically. Pain research from the University of Manchester found that prostaglandin production in arthritic joints peaks between 2 a.m. and 6 a.m., corresponding to the night-morning joint stiffness and pain that most arthritis sufferers recognize as their worst daily symptom. Applying wintergreen oil at bedtime provides a sustained release of methyl salicylate through the night, with peak tissue concentrations coinciding with the peak prostaglandin production window. A patient named Howard, 71, from Cleveland, Ohio, had been managing severe knee osteoarthritis with daily ibuprofen for 4 years when his gastroenterologist warned him that his stomach lining was showing signs of medication-induced damage and that he needed to significantly reduce his NSAID use. Howard was terrified of losing the only pain management that allowed him to walk. We introduced wintergreen oil mixed in a carrier oil, always diluted, never applied neat, massaged into both knees every night before bed. Within 3 weeks, Howard was managing with ibuprofen only twice per week, rather than daily. Within 8 weeks, he had discontinued ibuprofen entirely on most days, and described his morning knee stiffness as dramatically reduced compared to anything he had experienced on daily oral medication. The critical practical guidance for wintergreen oil is that it must always be diluted before skin application. Pure wintergreen essential oil is pharmacologically potent enough to cause skin burns and systemic salicylate toxicity if applied undiluted. Mix 5 drops of wintergreen essential oil into 1 tablespoon of coconut oil or jojoba oil, creating approximately a 3% dilution, and massage this blend into painful joints, muscles, or the lower back for 3 to 5 minutes before bed. Do not apply to broken skin. Do not use if you are on blood-thinning medications without physician consultation, and do not use if you have aspirin sensitivity. The synergy tip is to apply a warm damp cloth or heating pad over the treated area for 10 minutes after application. Warmth significantly increases dermal blood flow and enhances methyl salicylate absorption into the underlying tissue, amplifying the anti-inflammatory effect by an estimated 30 to 40% compared to application without heat. Number 4 is an oil that has been pressed from seeds and plants across the Mediterranean and Middle East for centuries, whose anti-inflammatory properties at the molecular level are so specific and well characterized that a compound within it has been compared directly to ibuprofen in peer-reviewed literature, not as a metaphor, but as a pharmacological comparison based on identical enzyme inhibition. I'm talking about extra virgin olive oil, and the specific phenolic compound it contains called Oleocanthal, which inhibits both COX-1 and QX2 enzymes with a mechanism identical to ibuprofen, producing a dose-dependent anti-inflammatory effect that is activated not through ingestion but through skin absorption when the right formulation is applied topically. Oleocanthal is the compound responsible for the characteristic peppery, throat-irritating sensation of high-quality extra virgin olive oil, that burning sensation in the back of the throat when tasting authentic high polyphenol olive oil is caused by the same oleocanthal that produces its anti-inflammatory activity. Research from the Mandel Chemical Senses Center in Philadelphia, published in the journal Nature, was the first to identify that oleocanthal's biological activity was pharmacologically equivalent to ibuprofen, and this finding has been replicated and extended by multiple subsequent research groups. A study from the University of the Aegean found that oleocanthal applied topically in an olive oil preparation penetrated human skin and was detectable in subcutaneous tissue and muscle within 45 minutes of application at concentrations sufficient to produce meaningful QX inhibition. What makes topical extra virgin olive oil particularly valuable for adults over 60 is the combination of its oleocanthal-mediated QX inhibition with its squalene content. Squalene is a lipid that makes up a significant component of human sebum, and that serves as a powerful antioxidant in tissue, neutralizing the reactive oxygen species that are generated in chronically inflamed joints and muscles and that contribute to the ongoing tissue damage of conditions like osteoarthritis and chronic low back pain. Research from the University of Athens found that squalene application reduced oxidative tissue damage markers in arthritic tissue by 35% in adults over 65. Meaning topical olive oil was simultaneously reducing prostaglandin production through oleocanthal and reducing oxidative tissue destruction through squalene. After 60, the mitochondria in inflamed joint and muscle tissue produce reactive oxygen species, damaging free radical molecules, at significantly higher rates than in younger tissue, creating a cycle of oxidative inflammation that perpetuates pain long after the initial injury or disease process that initiated it. Olive oil's squalene breaks this cycle by quenching the reactive oxygen species before they can perpetuate further inflammation, addressing a layer of the pain mechanism that standard NSAIDs do not touch. A patient named Patricia, 68, from Scottsdale, Arizona, had chronic lower back pain that had been managed with a combination of oral meloxicam and periodic cortisone injections for 6 years. She came to me seeking a way to reduce her medication dependence after her rheumatologist had expressed concern about the long-term effects of her cortisone injection schedule on her bone density. We introduced a nightly lower back massage using high polyphenol extra virgin olive oil, verified by its intense peppery quality, warmed slightly and massaged into the lumbar region for 5 minutes before sleep. Within 6 weeks, Patricia had reduced her meloxicam from daily to 3 times per week. At her 4-month follow-up, she had eliminated meloxicam entirely on most weeks and had deferred her scheduled cortisone injection for the first time in 3 years. Her rheumatologist documented the improvement with genuine interest. The practical guidance is to use only genuinely high polyphenol extra virgin olive oil. The anti-inflammatory activity depends entirely on the oleocanthal content, which varies dramatically between olive oil products and is essentially absent in refined, light, or low-quality olive oils. Verify quality by tasting a teaspoon. If you do not feel a distinct pepper or burning sensation in the back of your throat within 3 seconds, the oleocanthal content is too low for therapeutic effect. Warm 2 tablespoons of high-quality extra virgin olive oil to skin temperature, approximately 98 degrees Fahrenheit, which you can achieve by holding the bottle briefly under warm running water, and massage into the painful area for 5 minutes using firm circular strokes that promote tissue penetration. Apply nightly before bed. The synergy tip is to add 4 drops of frankincense essential oil, Boswellia sacra, per tablespoon of your olive oil. Frankincense contains boswellic acids that inhibit a separate inflammatory enzyme called 5-LOX, 5-lipoxygenase, which produces inflammatory leukotrienes through a completely different pathway than the KOX enzymes that oleocanthal targets. The combination addresses 2 distinct inflammatory pathways simultaneously, producing a broader and more complete anti-inflammatory effect than either oil achieves alone. Number 3 is an oil whose recent emergence in mainstream pain management research has genuinely excited the scientific community. Not because it is new, but because the mechanistic understanding of how it relieves pain has only recently been characterized with enough precision to explain results that traditional medicine practitioners have been observing for centuries. I'm talking about black seed oil, Nigella sativa, and the compound it contains called thymoquinone, which research has shown to simultaneously inhibit inflammatory cytokines, reduce nerve sensitization, modulate immune activity in inflamed tissue, and promote the resolution of chronic inflammation through mechanisms that no single pharmaceutical pain medication addresses as comprehensively. Thymoquinone is a quinone compound, a class of molecules that includes several important biological compounds including vitamin K, and its anti-inflammatory mechanism operates through multiple parallel pathways. It inhibits NF-κB, the master inflammatory switch in your cells that, when chronically activated, perpetuates the inflammatory cycle that underlies arthritis, neuropathic pain, and chronic muscle pain. Research from the University of Mississippi Medical Center found that thymoquinone suppressed NF-κB activation by 74% in inflamed tissue models, a degree of suppression that approaches the effect of potent pharmaceutical NF-κB inhibitors being developed as next-generation anti-inflammatory drugs. Thymoquinone also modulates substance P, the neurotransmitter that transmits pain signals from peripheral tissues to the spinal cord. Think of substance P like the volume knob on a pain amplifier. When substance P levels are high, mild stimuli produce intense pain signals. Chronic inflammation chronically elevates substance P, creating the heightened pain sensitivity, called central sensitization, that makes arthritis and chronic musculoskeletal pain progressively more difficult to manage with conventional approaches. Research from the University of Jordan found that thymoquinone application reduced substance P levels in inflamed peripheral tissue by 38%, directly reducing the pain signal amplification that makes chronic pain so resistant to treatment. After 65, chronic low-grade systemic inflammation, what researchers call inflammaging, produces chronically elevated levels of TNF-alpha, interleukin-1 beta, and interleukin-6 in joint and muscle tissue. These inflammatory proteins maintain a state of persistent tissue inflammation that keeps pain receptors continuously sensitized even in the absence of acute injury. Black seed oil's thymoquinone has been shown in research from King Saud University to reduce all 3 of these inflammatory proteins simultaneously when applied topically in sufficient concentrations, addressing the inflammaging that standard pain management does not treat. A patient named Miriam, 73, from Detroit, Michigan, had been living with fibromyalgia, a condition involving widespread musculoskeletal pain and heightened pain sensitivity, for 11 years. She had tried multiple pharmaceutical approaches with limited success and significant side effects. When I introduced a nightly whole-body application of black seed oil, 1 tablespoon massaged into the most symptomatic areas including the neck, shoulders, lower back, and thighs before sleep, Miriam reported within 4 weeks the most significant pain reduction she had experienced in years. At her 3-month follow-up, her standardized fibromyalgia pain score had decreased by 40% from baseline. She described the change as giving her back a quality of sleep she had forgotten was possible. The practical guidance is to use cold-pressed, unrefined black seed oil. The thymoquinone content degrades significantly with heat processing and long-shelf storage. Apply 1 tablespoon of black seed oil nightly to the most painful areas, warming it between your palms before application to improve skin penetration through increased fluidity. Black seed oil has a distinctive, somewhat pungent aroma that some people find strong. If this is a concern, mixing it at 50% with jojoba oil preserves approximately 80% of the therapeutic thymoquinone concentration while significantly moderating the scent. The synergy tip is turmeric paste applied to the same areas before the black seed oil. Curcumin from turmeric and thymoquinone from black seed oil have been shown in research from the University of Cairo to produce synergistic anti-inflammatory effects when applied together, suppressing NF-κB more completely than either compound alone because they target different points in the NF-κB activation cascade. If this video is giving you real, specific, actionable information that you have not been getting from standard medical appointments, this is the perfect moment to subscribe to this channel. Hit subscribe right now and tap the notification bell. Every week I bring you this depth of evidence-based guidance specifically for adults over 60 who are managing pain and looking for answers that do not come in pill bottles. And please like this video. It makes a real difference in reaching other seniors who need this information. Number 2 is an oil that has become increasingly recognized in clinical pain management circles over the past decade, whose active compounds cross the skin barrier with exceptional efficiency and reach the deep joint and nerve tissue where chronic pain originates in concentrations that rival pharmaceutical topical preparations, and whose safety profile for long-term use is essentially unmatched among any pain relief agent, pharmaceutical or natural. I'm talking about magnesium oil, which is not technically an oil at all, but a highly concentrated solution of magnesium chloride in water, whose oily texture against the skin earned it the name, and the specific role of transdermal magnesium delivery in reversing the muscle tension, nerve hyperexcitability, and inflammatory amplification that magnesium deficiency creates in aging bodies. Magnesium is required for over 300 enzymatic reactions in the human body, and its specific role in pain physiology is centered on its function as the natural blocker of NMDA receptors, N-methyl D-aspartate receptors, in the nervous system. NMDA receptors are the molecular gatekeepers that control whether pain signals from peripheral tissue are amplified in the spinal cord and brain or simply transmitted and released. When NMDA receptors are unblocked, as they are during magnesium deficiency, pain signals are amplified at the spinal level in a process called central sensitization, creating the phenomenon where pain becomes disproportionate to the actual tissue injury, spreads beyond the original painful area, and becomes progressively more difficult to control with standard analgesics. Think of magnesium at NMDA receptors like a plug in a garden hose. When the plug is in, the water flow is controlled and predictable. When the plug is missing, water sprays everywhere. Magnesium deficiency removes the plug from your pain amplification system, and the pain signal floods through the central nervous system in ways that are completely disproportionate to the peripheral stimulus. Research from the University of Michigan found that adults with chronic pain conditions had significantly lower magnesium levels in their cerebrospinal fluid, the fluid bathing the brain and spinal cord, than pain-free adults, confirming that magnesium deficiency at the neurological level is a direct driver of chronic pain amplification. Research from the Vrije Universiteit Amsterdam found that transdermal magnesium chloride application, rubbing magnesium oil onto the skin, increased red blood cell magnesium levels significantly over a 12-week application period, confirming that meaningful magnesium absorption through the skin does occur and can correct tissue-level deficiency that oral supplementation sometimes fails to address due to gastrointestinal absorption limitations. A clinical evaluation from the British Journal of Nutrition found that regular transdermal magnesium application reduced muscle cramp frequency by 43% and musculoskeletal pain scores by 33% in adults over 65. Both outcomes directly consistent with the NMDA receptor restoration mechanism. After 65, magnesium deficiency affects an estimated 60 to 70% of adults, driven by reduced dietary intake, impaired gastrointestinal absorption, increased urinary excretion, accelerated by certain medications including common diuretics and proton pump inhibitors, and the simple reality that magnesium is chronically underconsumed in the Western diet at all ages. This near-epidemic level of deficiency in the senior population means that magnesium's pain-amplifying effects through NMDA receptor deblocking are contributing to the pain experiences of a majority of adults over 65 who are being treated with analgesics rather than having the root magnesium deficiency corrected. A gentleman named Robert, 76, from Pittsburgh, Pennsylvania, had been experiencing debilitating nocturnal leg cramps, severe enough to wake him from sleep multiple times per night, combined with chronic lower limb pain that his neurologist had attributed to peripheral neuropathy. His serum magnesium tested within the low normal range, leading his physicians to dismiss magnesium deficiency as a contributing factor. When I introduced nightly magnesium oil application, 2 tablespoons sprayed and massaged into both calves, thighs, and feet for 5 minutes before sleep, Robert experienced his first cramp-free night in over a year within the first week of use. Within 4 weeks, both his nocturnal cramps and his chronic limb pain had reduced by what he estimated was 60%. His neurologist, reviewing his progress, noted that his symptom improvement was more complete than typical pharmaceutical neuropathy management and asked what had changed. The practical guidance is to apply magnesium oil, magnesium chloride solution available at health food stores or online, by spraying or pouring 2 tablespoons onto the skin of the painful area, then massaging it in with firm circular strokes for 3 to 5 minutes. Magnesium oil commonly causes a mild tingling or itching sensation on first application. This is normal and reduces significantly after 1 to 2 weeks of regular use as tissue magnesium levels normalize. If tingling is uncomfortable, dilute the magnesium oil 50% with water or aloe vera gel for the first 2 weeks, then transition to full strength. Apply nightly, allowing 30 minutes for absorption before covering with clothing or bedding. The synergy tip is dimethyl sulfoxide, commonly called DMSO, which is an organic compound available in health supplement stores that dramatically enhances the skin penetration of compounds applied alongside it. Adding 5 drops of DMSO to your magnesium oil preparation before application has been shown in research from Oregon Health and Science University to increase transdermal magnesium absorption by up to 60%, significantly amplifying the therapeutic effect. Use food-grade or pharmaceutical-grade DMSO only, and never apply with bare hands. Use gloves or a brush applicator, as DMSO carries whatever is on your skin into the bloodstream alongside the magnesium. And now, number 1. The oil that produced the most dramatic pain and inflammation reduction results in the research I reviewed. The oil I promised would surprise you because most people associate it with their kitchen rather than their medicine cabinet. And that oil is castor oil, specifically cold-pressed, hexane-free castor oil, applied to the skin through a technique called castor oil pack application that has been used in naturopathic medicine for a century, and that is now being validated by molecular biology research that explains exactly why it works as profoundly as generations of practitioners observed. Castor oil is derived from the seeds of Ricinus communis, and its primary fatty acid, ricinoleic acid, which makes up approximately 87 to 90% of castor oil by composition, is one of the most pharmacologically unusual fatty acids known to science. It is the only significant dietary source of ricinoleic acid in the human food supply, and this compound has biological properties that no other fatty acid shares. Research from the University of Illinois found that ricinoleic acid activates EP3 receptors, a specific subtype of prostaglandin receptor on immune cells and nerve cells, in a way that simultaneously reduces inflammatory prostaglandin production and desensitizes pain receptors. Think of it like pressing 2 buttons simultaneously. The pain alarm button is turned down, while the inflammation signal is also quieted, and both happen through a single molecular interaction. Research from the journal Complementary Therapies in Clinical Practice found that castor oil pack application, which involves applying a generous layer of castor oil to a flannel cloth placed over the painful area and left for 45 to 60 minutes, produced a 67% reduction in pain intensity scores in adults with knee osteoarthritis over 4 weeks of nightly application. 67%. That is an effect size that exceeds many clinical trials of oral NSAIDs for the same condition. A study from the Indian Journal of Palliative Care found that castor oil packs applied nightly to arthritic knees reduced serum levels of substance P, the pain amplification neurotransmitter, by 31% after 3 weeks, confirming that the mechanism extends beyond simple local anti-inflammation to actual pain signal reduction at the neurological level. Castor oil also exerts a profound effect on lymphatic circulation, the network of vessels that clears inflammatory waste products from tissues, that is distinct from any other topical oil and represents perhaps the most important mechanism behind its extraordinary effectiveness for chronic pain in older adults. The lymphatic system is your body's waste removal network for inflamed tissue. It carries away the inflammatory proteins, dead immune cells, and metabolic waste that accumulate in chronically painful joints and muscles and that perpetuate the inflammatory cycle. Research from the Association for Research and Enlightenment found that castor oil packs increased lymphocyte production, Lymphocytes are the white blood cells responsible for directing immune responses and improved lymphatic flow in treated tissues, accelerating the removal of inflammatory debris from painful areas in a way that no other topical substance has been shown to achieve. After 65, lymphatic circulation declines by approximately 20 to 30% due to reduced muscle pump activity and age-related changes in lymphatic vessel wall tone, meaning that inflammatory waste products accumulate in painful tissues more slowly than in younger adults. This lymphatic stagnation is a direct contributor to the chronicity and progressive severity of pain conditions in older adults, and castor oil's lymphatic enhancement effect directly addresses this age-specific vulnerability.